Hey everybody, Luke here, and in today's video we're talking about simple things you can do before knee surgery to improve your chances of a successful outcome after knee surgery. So that's the focus, is again what you can do prior to having surgery to kind of get the ball rolling, so that when you get out of surgery and out of the hospital, wherever you are, that once you start your PT or your rehab, the process goes more smoothly that way. So there's all sorts of different types of knee surgery. I'm not going to go into too much depth on that today, but you look at more simple things like meniscectomies or arthroscopic surgeries, where they just go in and kind of clean things up, and then more invasive things, like repairing meniscus or ACL, PCL type things. We treat a lot of older adults in the clinics. We see a lot of folks after they've had total knee replacements, which is a super invasive surgery. So as we go along with the 3 tips that I'm going to cover, I'll kind of mention some of those surgeries as we go, just to keep it relevant. But just keep that in mind, that all 3 of these should be pretty applicable to any situations. So let's go ahead and get into the 3 things that you can do to increase your chances of a likely or of a successful outcome after surgery. So early on, as you're preparing for surgery, the tip number 1 is to keep your range of motion or your flexibility as high as you can. Now, depending again on the shape of your knee and what type of a surgery you're having, it's going to vary a little bit, but you look like a total knee person. And the more range of motion or flexibility in the knee they have going into surgery, it's going to be much easier afterward to regain that after the surgery. And again, the total knee is the most common we see in the clinic, as opposed to some of the more sports-related ones. But some of these folks have had knee pain for a long, long time. And if they go into surgery with a really stiff knee, it's going to be just as stiff typically coming out of surgery. And then it's a lot more difficult to get the motion back quickly after surgery. It can be more painful. So the more those folks can work on stretching, flexing the knee, extending it, all those things before surgery, within reason, because the knee is painful, the better the outcomes after surgery. There's actually quite a bit of good research, or one main research paper, about people preparing for total knee replacement by doing physical therapy before surgery, and statistically much better outcomes after surgery. So that's tip number 1. Keep that knee as flexible as you can. Get it moving, stretch it, always within reason, because you're not trying to add more pain to an already painful knee. So that's your tip number 1. The second tip then is to keep the quad strength as high as you can, or if you've got a weak quad, to strengthen it going into surgery. It's the same principle for all of these things. Basically, the more strength you have in that quad muscle, which is the primary muscle that surrounding your knee along the front of your thigh, the easier it is to regain that quad strength after surgery. Again, if we use the total knee example, it's a very invasive surgery, a lot of pain, a lot of swelling, because they're really traumatizing the knee. One of the earliest things you want to do then following surgery is you're trying to reactivate that quad muscle, which again is that really big group of muscles along the front of your thigh. And for a lot of folks, it's really difficult to activate that muscle because of the pain and the inflammation and the swelling. And it's also difficult for them because previous to surgery, they really didn't have much going on in that quad. They weren't using it a lot. The knee was very painful, so they're not bearing a lot of weight on it. And if they could have just gotten that quad fired up before surgery, would have made their rehab much easier. So that's tip number 2, work on that quad strength. The third tip that's most relevant to knee surgery is you also want to work on strengthening the hip muscles going into surgery. You could look at the entire leg. You want to keep the entire leg strong, but really the hip muscles are huge when it comes to your ability to regain normal walking patterns and to regain things like balance. Again, bearing in mind that we work with a lot of older adults for like the total knee replacements. So a weak hip is really going to affect the alignment of the knee. It's going to affect the entire leg in terms of how well you can walk on it, shift your weight over to that leg. And when you look at especially an older adult, it takes a long time to build strength. So if you're going to want strength in your hip after surgery, start building it before surgery. Now, the nice thing with hip strengthening is that there's several things you can do that really shouldn't bother the knee. So you look at some of the exercises I've got on different videos for hip strengthening, knee strengthening, and a lot of these you can do very comfortably leading up to surgery and shouldn't make you any worse for the wear. So you look at things like laying on your back and doing a straight leg raise, should be pretty good. If you're looking at more hip strengthening, laying on your opposite side and lifting that top leg and hip up towards the ceiling like a side leg lift. So keep some of those things in mind, and if you want more information on that, just look at some of the other videos I have. But that should really be doable leading up to surgery, and it should pay off big time. So again, keep in mind, especially if you're a little bit older, which I keep saying, that these things don't happen very quickly. So you can get a real jump start on the post-surgical recovery if you just start doing some of these things before surgery. Give yourself at least a month or 2 to start getting there. So that's the video for today. If you're heading into knee surgery, again, those are your 3 tips. Keep that knee as flexible, range of motion we call it, as you can, increase your quad strength as much as you can, and then increase your hip strength as much as you can too. So that's it for today. If you have more questions, please feel free to leave a comment below the video, or I'll leave my email down in the comments there too. You can always email me specific questions. So there you go. Thanks for watching.